2-minute anesthesia pharmacology key drugs Midazolam. Midazolam was initially approved by the US FDA in 1985. It is a imidazobenzodiazepine. This will be discussed on the next slide. It's used for sedation, co-induction, muscle relaxation. It has anticonvulsant, amnesic, anxiolytic properties. The IV preparation is a clear colour solution, usually at 5 mg and 5 ml. The oral preparation is a clear liquid with a bitter taste. How does it work? Midazolam binds to the benzodiazepine binding site between the alpha and gamma subunits of the GABA A receptor, allowing allosteric modulation. Allosteric modulators are a group of substances that bind to a receptor to change the receptor's response to the stimulus, i.e., on binding on midazolam to the receptor, this potentiates the normal physiological response of binding of GABA to the receptor, enhancing chloride conduction and enhancing hyperpolarization of the neuron. It can be given PO, nasal, PR, IV, IM, epidural, intrathecally. The pediatric dose for preoperative sedation is 0.5 mg per kilogram, max dose 20 mg, ideal body weight. Adult doses, IV up to 0.1 mg per kilogram for sedation. The onset for IV doses is 2 minutes, and the oral doses can be around 30 minutes. Systemic effects: respiratory, reduction in tidal volume, increase in respiratory rate. At higher doses of midazolam, patients can develop reduction in respiratory rate leading to apnea and CO2 retention. Cardiovascular, reduction in blood pressure, secondary to a reduction in SVR. Patients may develop a compensatory tachycardia. CNS, reduction in cerebral blood flow, reduction in MAC value. Musculoskeletal, muscle relaxation. It has a bioavailability of 40%, protein binding of 97%, pK of 8.5, weak base, volume distribution 1 litre per kilogram. It undergoes metabolism by hepatic and gut CYP3A4 to 1-hydroxymidazolam, which is active, and 4-hydroxymidazolam, which is inactive. It subsequently goes under glucuronidation. It is eliminated in the kidneys with less than 0.5% excreted unchanged. On overdose, patients may present with ataxia, hypertension, bradycardia, and respiratory depression. This can be reversed with flumazenil. Paradoxical reactions can occur, i.e. patients may become agitated. Midazolam exists in different structural forms depending on the environment. This is known as Tautomerism. This is secondary to the pH-dependent imidazole ring. Our pH is less than 4, i.e. within the ampule has hydrochloric acid, so the pH is 3.5. The ring is closed, the molecule is ionized and water soluble. On injection, the pH is greater than 4, so the ring opens and can cross the blood-brain barrier due to the increase in unionization and lipid solubility.